Okay, so now we're back to our framework, and we're going to talk about some of these things kind of one at a time. So the first one we'll talk about is aortic stenosis. So the typical patient will be older with degenerative changes. Usually patients are going to be in their 70s or 80s, or younger patients with bicuspid aortic valves. Okay, so this is a congenital problem that people are born with. Arnold Schwarzenegger had a bicuspid aortic valve, and that's why he had his aortic valve replaced at age 50 or however old he was. He was young. And so those are kind of your two demographics. So if the question describes a younger patient with bicuspid aortic valve, you should automatically be thinking about aortic valve problems, either stenosis or regurgitation. These patients will present with angina, syncope, dyspnea. And on exam, as we've already talked about, you're going to get a crescendo-decrescendo systolic murmur at the right upper sternal border. So that's where the aortic issues tend to be. And then there's radiation to the neck and clavicle in bold, because again, if you see that, you're done. Soft S2, S4 gallop because of the concentric left ventricular hypertrophy that happens. And then pulsus parvis et tardus, again in bold, because these are pathognomonic for aortic stenosis. So these are good things to commit to memory, because if you see them on the test when you're flying through and you're sweating, and you're like, man, I'm getting all these wrong, you see that, you're in good shape. Other clues would be LVH or left axis deviation on EKG. Okay, so echo is going to be helpful for sort of characterizing the severity of the lesion. So these are just, you're just going to have to memorize these in terms of kind of the aortic jet velocity and then the mean gradient. And probably they'll just want you to know maybe what severe is. So maybe just remember 4, so 4 and 40. And then aortic valve area used to be part of the criteria, but it's no longer. But in general, severe AS is associated with an area of less than 1 centimeter squared in severe AS. Okay, so in terms of management, aortic valve replacement, we'll skip down to the bottom of the slide. Symptomatic severe AS, surgery. Asymptomatic severe AS, if they're going to have another valve replaced or a bypass surgery, you're going to be in there, you might as well replace their severe AS, even though it's not symptomatic. If they have LV dysfunction, you should repair the valve. Otherwise, it's serial echo. So it's yearly in patients with severe AS that are not symptomatic or don't otherwise meet criteria, every 1 to 2 years for moderate AS, and every 3 to 5 years for mild AS.